evening everyone. This is Dr. Pawan Rasalkar here, cardiologist. Firstly, thank you so much for having me here and for this opportunity. I hope everyone is comfortable in English here. So my talk is split into two. One is some of the important tips about heart health. These days so many heart attacks happening. Forget about elderly, very young people are dying because of heart attack, not even reaching to the hospitals. So what are the things we should know about heart health to keep ourselves healthy? That's the first part of the presentation. Second is about CPR training, which is one of the most important life skill which everyone should be knowing, how to give a CPR. So I'll begin my talk with how to keep the heart healthy. This is going to be an interactive session, not a one-way session. Let me begin my talk with one question. So when do you think the heart starts working? From the womb of the mother. Okay. At how many months in the womb? Third week. Any other answer?
3 months. 3 months.
3 months. 3 weeks, 3 months. Any other answer? Okay, it's 5 weeks. So it's the 5 weeks of gestation. That's when the child is being born. The heart starts. This is the first organ of the body to start. This is the last to end. Your kidney may be failed, you will still live with dialysis or a transplant. Your liver may be failed, you will live. Your lungs may be failed, you will somehow live. The day your heart stops, you are gone. Doesn't matter how healthy all the other organs of your body are. So this is a very special organ, and it is very important for all of us to take care of it very properly. Question number 2. What is the function of the heart in the body? What does the heart do?
Blood circulation.
No, it doesn't purify the blood. Yeah,
Circulation.
it circulates the blood. See, if you imagine our body as a vehicle or a car, heart is the engine. Like the vehicle requires petrol for its functioning, all the organs of the body require blood, which carries the oxygen as well as the essential nutrients to function. So heart does this critical function of making sure all the organs of the body receive its fuels. So it pumps blood. The purification is done in the lungs, madam. The oxygen and carbon dioxide supply, and once the pure blood comes back to the heart, it is pumped to the whole body. The impure blood comes back to the right side of the heart, it pumps it to the lung. Purification and back to the left side. So this is the function of the heart. And like all the organs of the body, even heart requires its own blood supply to function. Heart is a muscle pump. So to keep going, it requires its own blood supply, which is done via 3 coronary arteries or small vessels which supply the blood to the heart. The heart pumps, the blood comes and goes to the whole body, and along with the other organs, even this blood goes into these vessels and supplies the heart, by the virtue of which the heart keeps pumping. Now, if there is any problem in this heart vessels called as coronary arteries, this is what we call as coronary artery disease, or in very simple terms, heart attack. So if you look at the picture here, this is the heart, which is a muscle pump. There is one coronary artery here on the right side, one on the left, one will go on the back side, through the left side, it goes on the back. So there are 3 coronary arteries or 3 vessels. All of this supply blood to the heart and keep it pumping. So any blockages in this vessel leads to heart attack. And that is what we refer to technically as coronary artery disease. And similar to heart, any organ of the body which has blood vessels can develop blockages. Your legs, which is called as the peripheral arterial disease, or the brain, the vessels of the brain may get occluded, which leads over a period of time into something called as stroke, brain stroke. Half of the body doesn't move. So it is not just the heart vessel which can develop blockage. All the other organs and of the body which have vessels can develop the blockages. Most common is heart. Second important part of my presentation, what is the symptoms of coronary artery disease or heart attack? What are the early symptoms? Can anyone of you tell me what are the symptoms?
The pain in the heart.
Yes, pain in the chest. Then
Back pain.
pain in the back.
And the jaws also.
Radiating pain to the shoulders.
Yes, radiating pain to the jaws and shoulders. Anything else? Gastric. And
Numbness.
numbness. Anything else?
Disorientation.
Disorientation. Okay, so basically, the coronary artery disease or heart attack early symptoms can be broadly divided into two. One is typical symptom. Typical symptom means this happens in more than 90% of the people who have had a heart attack. So that's a typical symptom. That is what every one of us know, that is chest pain. No one ignores chest pain these days, especially in metro cities like Bangalore with access to healthcare. Some chest pain, always people end up coming and getting an ECG done at least and clearing out. So chest pain is the most typical symptom. Usually it happens in the center of the chest or on the left side. Can radiate to the left side of the shoulder, left side of the arm, left neck or even jaw. And typically this chest pain is something like heaviness on the chest or a crushing sensation or a dull aching pain. Usually it increases on exertion. Assume you are every day going to the park and walking 5 kilometers, but of late you are noticing that you are not able to do that. You are having chest pain. But when you slow down or you stop walking, the chest pain intensity goes down. So this is how the typical cardiac chest pain presents. Technically, we label this as angina pectoris, which is a Greek terminology, which means chest pain, usually on the left side, can radiate to the jaws, shoulders and the left arm, on exertion and relieves on rest. So this is how the chest pain of heart attack or early stage of blockage is present. The problem is not this. Most of us here, even school-going children know chest pain means alarm. There is some problem. You need to consult the doctor. But what I want to put across today is not the typical symptom. The atypical symptoms of coronary artery diseases. Atypical symptoms means which are present in less number of people. Around 10% people of blockages do not present with chest pain at all. But it is not that, you must have heard terminologies like silent heart attack. Someone had a silent heart attack, they never had chest pain. No heart attack is truly silent. There will be some symptoms other than chest pain. So these are called as atypical symptoms. That is what I want you to know today. There are usually 4 to 5 atypical symptoms. That is, on exertion breathing issues, on exertion fatigue or weakness, palpitations. Your heart, you feel that your heart is beating fast, and finally gastritis. I'm so glad someone mentioned that. So these are the atypical symptoms. If you are having these symptoms for a long time, that you are walking, you are having breathing problem, feeling extremely fatigued, but no chest pain, the other symptoms are there, still you need to get your cardiac evaluation done. I am not saying if you are going out of breath after climbing 2 stairs, you are having a heart attack. I am not saying that. But if it has been persistent for a long duration of time, and if it is a new symptom, you are all fine till yesterday and suddenly off late you are noticing this, please get a cardiac evaluation done. So this can also be related to heart. And probably one of the most common missed symptom, atypical symptom, is gastritis. It happens so many times. I am damn sure you also must have heard it among your relatives or friends or colleagues. Everything was fine. I was having gastritis for a month and suddenly one day doctor is telling heart attack, I had to go to the emergency, I got stented. This is a very common symptom. Sometimes if the right side vessel of the heart, the right coronary artery which supplies the base of the heart, lower part of the heart, the lower part of the heart is in direct contact with stomach, and there is one membrane separating, is called as a diaphragm. So if there is blockage in the right side vessel which supplies the lower part of the heart, there may not be chest pain. It may be just gastritis. Again, I am not saying every gastritis is heart attack. You don't have to get panicked. But if the gastritis is persistent, you have visited your doctor or you have taken the gastritis medication, pantoprazole, Rantac, Gelusil, still the gastritis is not going away at all. Or if the gastritis is coming when you are walking, the gastritis, the burning sensation comes, you slow down, the burning sensation goes. It may be heart related. Better to get an ECG done. In fact, I'll tell you, forget about layman general public, even many doctors miss that. So many times it happens, you end up going to the doctors, they keep on changing the gastric medication, sometimes they give you the IV medication, no one does an ECG. I'll give you a very recent example from your own apartment. 4 days back it happened. Elderly gentleman, 78 years, recurrent gastritis, and one day suddenly the gastritis increased. He went to your Apollo clinic here with gastritis. Dr. Kiran was here. Sir is here, right? Yeah. It was a great pickup by him. Who does an ECG for a gastritis? But the symptoms were like that. I think Kiran sir can tell it better how the patient presented. He got an ECG and it was a major heart attack. Immediately shifted to Manipal. He had called me and intimated me right before that the patient is going to come, we were already all three vessels blocked. 90, 90, 90. The BP was so much low and the other parameters were not good. I had to stent all the three vessels. Thankfully, in time presentation, discharged successfully yesterday. Sir, how was the presentation? I mean, the patient didn't have any chest pain at all. So I think, you know, Dr. Kiran is your own physician.
Most of you know I am Dr. Kiran. I am a physician here at Apollo Clinic here. This is one of our building 1 resident. To be precise, he was a 75-year-old. No diabetes, no blood pressure, no cholesterol. I was sitting at 7:30 in the clinic. He just walked in alone, absolutely comfortable, no signs of any stress, distress, nothing. He came to me, he said, I have some gas since 2 days. Not even pain, not even vomiting sensation, nothing. He just said, like casually, sir, I have gas since last 2 days. I went to some marriage functions. Last 2-3 days there's a lot of marriage functions. So I had to eat outside. So just see, sir, if you could give me something. During our routine examination, what I could notice is he had a very high blood pressure. I asked him the history. He never had a high blood pressure. But suddenly there was a very high blood pressure. It was almost like 110, 180 by 110. That was a clue. So I told him, like, it's okay. You have a high blood pressure. We have to give you medicine. We have to control your blood pressure. I'll give you the gastric medicines also. But let us do one ECG. Before you walk out of the clinic, I insist you do one ECG. And if that is fine, you can come tomorrow, do the blood test, do the ECG, that is all fine. But let us do one ECG. Fortunately, he listened. And we had a ECG, he could record the ECG. ECG was showing not even a classical major attack like signs were not there in the ECG. They were, you can say, mild to moderate changes, which were not like very confirmatory. Then I had to seek help from Dr. Pawan. I sent the ECG. See, another good thing what he did is, see how luck plays in these roles. When he walked in, he had his old medical file with him. So he brought that, he judiciously brought that. And I could search for one ECG, his old ECG, whether you had done some old ECG, let me check whether that ECG and this ECG, whether it correlates or it is something different. So fortunately, we had one ECG of December 2024. That was perfectly normal ECG. And these changes were obvious. So then I had to call Dr. Pawan. I told him. And then because he was walked in alone, so then I made him lie down in the clinic. I called his son, who was probably doing work from home or something. Then made him to come to the clinic, explained him the situation, explained him the urgency and the seriousness of the situation. And we could take him to the Manipal hospital because that was the nearest, and Dr. Pawan was already ready. He told me, sir, you shift, we will be there and we will be waiting for the case and we will take it immediately. And that is what he went, and sir intervened. And see, this thing is, when he approached me, his blood pressure was high, and probably when he was already on the OT table, his blood pressure had dropped. So it was just a matter of maybe an hour. So see, these all things, see, many times, see, what my suggestion for you, anything unusual, anything which you have never experienced before, please give attention to it. Whether it's a chest pain, see, in my career, I have diagnosed one MI with a patient with diarrhea. He just walked into a patient that he had a loose stools 2 times and found to have a heart attack. So that's why, see, it is all subtle clues for us when we examine the patients and when we do this thing, because in our medical field, never 1 + 1 is 2. So it can be anything else. So that subtle clues, what we get is what matters. So that's why seek your help, because see, you have accessibility, you have a clinic, you have a doctor, Manipal is nearby, I am there. If when I am there, you can come to me. If I am not there, then you can reach either Dr. Vishwanath or Dr. Pawan. So, but seek help, because this is a fragile age. Okay, don't assume or don't accept anything that on your own, okay, this could be this could be this could. Anything, just simple consultation. Just come talk to us, like you get an examination, and if it is fine, everything is fine. If it is something, please listen also, because many people may be cursing also. Hey, the patient, I came to with him to some gas and he is asking for me to do ECG and echo and all, so commercial, all this thing. They will tell all sorts of this thing. See, 10 cases if you do ECG, if I could detect one ECG, I feel it is still worth. 9 may be wasteful. 9 may not be give me the fruitful results. But one case, if I could detect and I could save the life, that is worth doing those 10 ECGs. That is what we follow in this thing. Anyway, Dr. Pawan will continue. Thank you, sir.
The gist of the story if there is anything abnormal happening in your body, listen to it and don't ignore it. And coming back to the atypical symptoms, so who are the people who can have this atypical symptom more? Women, age more than 60, diabetic people, and overweight people. These 4 subset: women, diabetic, age more than 60, and obese, overweight people. They sometimes do not have chest pain. So if you fit into any of these groups and have atypical symptoms, it is more so a reason to get your heart evaluated. Coming to the demographics, I wouldn't spend much time here. So heart attack is the #1 killer worldwide. Putting all the other diseases at one part versus heart attack and heart diseases, still heart diseases score over the number of people it kills every year globally. And more so in India. You know, the heart attack capital of the world is India. More people die of heart attack in India than any other country, maybe any other continent. The reason being that is multiple. One is the poor genetics. Southeast Asians and Indians, we have genetic abnormalities which make us prone to develop heart artery blockages. And our point 2, our lifestyle is not good. If you have ever visited abroad, European countries in particular, the Western countries, they give a lot of importance for lifestyle. They eat on time, they sleep on time, they work only 5 days, they exercise every day. So our lifestyle is not like that. We are always in the run, always rushing, we don't eat proper food, we do not exercise. So this is another important factor for us to have increased chances of heart attack. Next is the risk factors. I will not spend much time here because I would want to spend more time on the CPR. Risk factor of heart attack. So what are the things if you have increases your chances? Risk factors again can be majorly divided into 2. One is non-modifiable risk factors and secondly it is modifiable risk factor. Non-modifiable means there is nothing you can do about it. In that there are only 4. One is age, that is men more than 40 and women more than 50. Second is gender, men are more prone for heart attack than women. Third is ethnicity. If you are Southeast Asian and Indian, more chances of heart issues. And fourth is family history. If your first degree relatives, especially your parents and sibling, anyone has a heart related disease, your chances of having it is at least 50%. Coming to the non-modifiable risk factors, non-modifiable risk factor is in fact the more percentage which leads to heart attack rather than the other 4 things. High cholesterol, high blood pressure, high sugars, overweight, bad habits like smoking and excess alcohol consumption, obesity, physical inactivity. So this list needs to be corrected. If you can keep all these things under control, your chances of having the heart attack is very, very less. I wouldn't go great into details about the risk factors. I will be telling just the important points. So what is to be done to prevent heart diseases? Strategies, that is called as strategies to prevent heart diseases. See, it can broadly again be divided into 2. One is primary prevention and second is secondary prevention. Primary prevention means you do not have heart disease currently, but you are taking measures and you are being careful so that you never develop a heart disease. This is called as primary prevention. Next is secondary prevention. That means one heart related event has happened, you have had a heart attack or heart failure, but now you are doing the necessary changes to prevent a second episode in your life. That is secondary prevention. Primary prevention is very, very simple. 7 golden rules. One is the diet. It is very important that you follow a very proper diet. Because of the paucity of time, I wouldn't go into the details. So, rule number 1, you have to be very careful about your diet. Rule number 2, exercise. I will tell some important points about exercise here, but what kind of exercise is required. So what is your opinion? What kind of exercise you should be doing to keep your body and heart healthy, and how much duration you should be exercising, whether more exercising is more beneficial? Your thoughts on this?
Walking is the
Walking is
best
good for walking.
exercise.
Brisk walking,
Yeah.
then
And how much you should do, you don't know.
how much you don't know? Okay, I'll tell you.
Stretch exercise.
75 no exercise.
Deep breathing.
Deep breathing, okay?
So exercise depending on the calories you are consuming.
Okay, how much you are eating, that much you want to burn. Okay. How much? What's the duration? Do you think that the people who are gym junkies, 2 hours, 3 hours in gym, do you think they have more benefit?
30 minutes.
Correct. They are at harm actually. So coming to the kind of exercises we should be doing, it is cardiac related exercises, we call as isometric exercises. Nothing weightlifting and all is not at all required. What you need is just aerodynamic exercises, the minimum of which or the simplest of which is brisk walking, cycling, jogging, swimming. This is all that is required. Even if you are going to the gym, most of the times it is treadmilling or cycling with very less of weight training. Point 2, what is the duration of exercise? Minimum half an hour, maximum 1 hour. Not more than that per day, and also please take 1 day off. Sunday off.
At a stretch or you are morning?
It can be done either way, sir. However is convenient for you. If you want half an hour in the morning, half an hour in the evening, you can do, or else you can do it at one stretch also. Exercising beyond 1 hour and over exercising, too much of weight training, taking supplements for muscle building can be detrimental. And many of these engaged gym deaths which you see in relatively very fit individuals, one of the factors for this is over exercising and taking supplements, which should be absolutely avoided.
But again, senior citizens, it is difficult for this, maybe running, jogging, or even.
Simple walking at whatever speed you want to do, ma'am. That is all that is required. Do whatever is comfortable for you. I mean, there is no set rule that you have to walk at this speed, you have to always walk 5,000 steps. No. According to your age, your functional capacity, according to how your body responds, do minimum possible things. That's the recommendation.
For a person of about 75, what do you
2,500 steps per day, probably 2 to 3 kilometers. Slow walking or a medium speed walking is all that is required. So that was rule number 2. Rule number 3, 4, 5, 6, 7 is very simple. One is smoking. How many of you are smokers? No one? A lot of liars here.
Let's put occasional for everything.
Okay. I think as a cardiologist, this is my 10th year after I passed my cardiology degree, that's DM. Seeing heart attacks is my everyday job. Single most important risk factor for heart attacks in the young is smoking. Without doubt. There are so many patients who come to me 35-year-old with major heart attacks, we stent, and while discharge we advise them that don't smoke. They look at us very suspiciously. I smoke once in 5 days, only one. I'm a social smoker. I don't know this terminology existed. Of late I'm coming to know. I knew it is social drinking. They say I'm a social smoker. I smoke only when I drink. Oh, so they give a lot of explanations about how smoking is not the reason for that, but the fact remains smoking is the reason. Smoking is absolutely no, not even once in 20 days. Okay, so that is one of the most worst habit to have. Smoking should immediately stop if at all you are doing. And the other rules are very simple. I wouldn't go into the details. If you are having high cholesterols, if you are having high sugars, if you are having high blood pressure, or if you are obese, all these things should be well controlled. Now, another common challenge for us as doctors in our clinic or in our practice is how to convince the patient to take the tablet for their own good. No one wants to take tablet. Even I don't want to take tablet. Let me be clear about it. Given an option, I don't want to take a tablet. If at all I have a diabetes or blood pressure or anything for that matter. But there are certain cases in whom we can do without tablet, just with lifestyle changes. Good exercise, good diet. The BP normalizes, the cholesterol normalizes, the sugar normalizes. At the same time, there are some people in whom the lifestyle changes are not enough. Lifestyle changes has to be done in everyone. It depends on how much the abnormality is. If your BP is 250 and you are saying I will walk brisk walk 5 km and make it normal, not possible. If your sugar is 300, that's not possible. So what in the initial stages of the disease, borderline cases, we ourselves advise just lifestyle changes, but when it is beyond a point, or if even in the initial stages we have given a 3 months trial of lifestyle changes and it is not working, better to go on tablet, a simple tablet every day, and keep the numbers, the cholesterol, the sugar, the BP under control to prevent future problems. All these are silent killers, diabetes, hypertension and high cholesterol. You are not going to have any symptoms for many years, and suddenly one day the hell will break loose. Strokes, heart attack, kidney diseases, blindness because of the retinal damage of long-term diabetes and hypertension. We come across very commonly people coming with end organ damage. They will be having blood pressure for years together. The reason and their logic for not taking medication is, I didn't have any symptom, why was the medication necessary? Don't be under this myth. Go to your doctor whom you trust. I'm not saying that everyone is very good in all the professions. There are black sheeps everywhere. Go to your doctor who you trust a lot and follow the advice blindly. This is what my suggestion is, because these are all very preventable causes of problems in future. So before I wind this talk, an important question. How many of you get your regular preventive health checkup done?
We will again lab test.
Okay, so 80%. I'm so glad sir is doing it because he's young. Young people usually don't do. Why should we be doing a health checkup? Some part of it was covered by Vishwanath sir there. We'll stop. Prevention is better than cure. Yeah. Again, so many times it happens. Heart attack patient come in, we stent them and we do the risk factor analysis. Cholesterol is 400. I ask them a question. When was the last time you did the cholesterol? The reply is, why? I have never entered hospital. I have never seen a doctor in my life with a sense of pride. If they had done the cholesterol a year back, the heart attack wouldn't have happened. See, again I will give this analogy which Vishwanath sir gave. All of you have bikes, all of you have car. Do you go to the garage only when it breaks down, or you give it yearly once for preventive servicing? Why should you give your car? Car is working fine, right? Why do you give to servicing? To see that the oiling is done properly. If there are minor issues, they are sorted out. Same thing is with your body. Your body is the most important vehicle you are having. You live in it. So taking proper care is very important. Many of the diseases do not have symptoms for years together. Your sugar may be 400, 200, you may not have any symptoms, but a health checkup will catch it. So if you are detecting this in early stages, then we can correct it just via lifestyle changes. Your sugars are borderline 150 fasting, no tablet is required. HbA1c is 6.5, 5.8 to 6.5, no tablet is required. Your BP is between 140 to 150, no tablet is required. But how will you know? You are not going to have symptom. When you do your yearly checkup, when you identify it early stage, just lifestyle changes, little bit higher, a simple tablet, future bigger problems like strokes, heart attacks and sudden deaths will be sorted and you will live a long and healthy life. Next question, at what age should the regular health checkup be starting? I'm so glad all of you do it. See, if you go by the data and the studies done, after 40 years of age, if you do not have any problem, if you are not a known diabetic hypertension, you are absolutely fine. After 40 years of age is what the recommendation is, and every 3 to 5 years then after. But what we are seeing these days, especially me as a cardiologist, so many younger heart attacks. This year's youngest angioplasty of a major heart attack I did was 19-year-old boy. Can you imagine that? 19-year-old. So what I recommend is, after everyone crosses 20 years, a regular health checkup to be done every 5 years. Till 40 years of age, and after 40 years of age, yearly once. What are the tests needs to be done? Hemoglobin, kidney, liver, cholesterol, sugar test and a complete cardiac evaluation and then ECG, echo and TMT. One more situation I will tell you which is very common. Last month only I got ECG, echo done. This month I had heart attack. How was it missed? So this thing is, to do a complete cardiac evaluation, treadmill test is very important, TMT, because ECG and echo catches the heart problem at a very late stage. In early stage blockages, we have to do the treadmill test. And another side, even treadmill test has at least 10% chance of missing the blockage, in which situation we advise CT coronary angiogram. We do not advise CT coronary angiogram in everyone because it involves radiation exposure and giving a contrast agent injection. So there are certain subgroups in which we advise CT coronary angiogram with a strong family history of heart disease, multiple comorbidities, like high blood pressure, high sugar, high cholesterol or smokers, elderly people. In these people, it's on the heart health. I hope this was useful for you. Next, I will be going to the CPR thing.
Doctor, is echo replacement for TMT? Or?
Not at all, sir. So ECG, echo and treadmill. They are very different
Elderly
tests.
people usually have knee issues.
Yeah, that's why I said in elderly we go with CT coronary angiogram. If the suspicion is high. If the suspicion is low, like they do not have any comorbid conditions, they are non-smokers, no family history, ECG and echo is enough.
But they say it is quite dangerous to have.
No, that is the invasive coronary angiogram I think which you are referring, madam. I am talking about the CT coronary angiogram. It is a simple CT scan of the chest.
Can you please explain this portion for a little while to us?
Which one?
What is the procedure?
CT coronary angiogram. Yeah.
And what is the cost? And how long does it take? And what is the size? Okay, just 2 minutes.
CT coronary angiogram is just like any CT scan.
Okay.
All of you are very well aware of CT scans.
Yes.
It was in COVID, everyone was getting it done. It is the same CT scan.
Right.
But they give an intravenous injection of contrast agent, which is a small injection, non-painful.
Okay.
The chances of any problems happening with this injection, like allergic reaction, are less than 1%.
Okay.
99% plus no problem happens. They give the contrast agent, this contrast agent goes to the heart vessels and then they take the photos of that. The entire procedure is just 2 to 3 minutes. But the heart rate control is important before we do the CT scan. In some people the heart rate is on the higher side, wherein you give some medications and make them wait for 1 or 2 hours till the heart rate comes under control. Because if the heart is beating very fast, the images will be of poor quality. So we want the heart rate between 60 to 70 at rest. If your heart rate is within that range, direct. Or some medications are given which will reduce your heart rate to 60 to 70 and it is done. The procedure per se is just less than 5 minutes. Cost, it depends on where you are getting it done. In government-run institutes, it's 5,000. In most of the diagnostic centers, it is 10 to 12,000. In bigger corporate hospitals, it is somewhere between 15 to 20,000. Okay, so basically between 5 to 20,000 is the cost.
Please go ahead. One question, sir. You didn't mention anything about low BP. You talk only about high BP. What about low BP? Does it not affect?
Low BP usually happens in already established heart conditions, sir, especially in older people and in men. Some women of reproductive age go heart attack and cardiac arrest.
Usually heart attack is blocking the heart or arteries.
Okay, madam.
And cardiac arrest is suddenly it stops working.
Bang on target. I thought no one will answer this, but madam answered that. See, heart attack and cardiac arrest are very different terminologies. On social media, in TVs and in general public, the misconception is there, they are both the same thing, but it's not. Heart attack is a very specific terminology that means blockage in the heart vessels or coronary arteries. Cardiac arrest is a broad terminology. It just means the heart has stopped pumping. The reason for the heart stopping pumping can be many. That is the final terminal event. There may be kidney failure, liver failure, stroke, multiple infection, multi-organ dysfunction, and finally the heart stop. That is cardiac arrest. One of the reason of cardiac arrest is heart attack. That is heart artery blockage, and if the blockage is of very high intensity, the heart may suddenly stop pumping. The cardiac arrest happens. And in major heart attacks, at least 20 to 30% of the people don't reach the hospital. That is because when the attack happened, their heart stopped pumping, and by the time they reach the hospital, it is beyond repair. We cannot restart it. I think sir gave an example of the patient of some other apartment which we resuscitated and did the stenting. The patient is all good now. Now here is where the importance of CPR comes in. When cardiac arrest happens, how to save the patient? Do anyone of you know? You are roaming around in the park, someone collapses. How can you help the patient? Because if the patient reaches after 7 minutes to the hospital, the heart cannot be restarted. It is only 7 minutes, that's the time we have for making any effort for the heart to restart. Beyond that, you will be hearing terms like broad death.
Loading dose is
No, patient has collapsed. Loading dose is chest pain is there. Then we ask to take the blood thinners and come to the hospital. Now the patient is flat gone. What should you be doing? CPR, yes. CPR, the medical fraternity knows if you come to the hospital, someone has collapsed, they start the CPR and revive the heart. But if the patient has collapsed outside, which is the case in most of the cases, what to do? Who should do the CPR? By the time the ambulance reaches, patient is gone. So that is where the importance of the bystander CPR comes in. Whoever is there available at that site should start the CPR and some other person should call the ambulance. And many a times it happens, you are doing CPR in 30 seconds the patient wakes up because the heart starts pumping back. And then you shift him to the, it's not that he wakes up, you send him home. You send him to the hospital for the further evaluation. So this is a very important life skill to have. Like swimming is for your sake, to save your life. CPR is to save the life of your loved ones. Very important skill. Okay, now let me start off with this. Okay, one question again. Someone has collapsed and fallen in front of you. How do you do that? How do you do the CPR? Does anyone of you know?
Just
Okay, so someone has fallen and you will go and start giving chest compressions. Every one of you agree?
Yes.
Wrong. See, this is the sequence. This is a very important slide. If you want to take photos of this, you can. First and most important thing, you are not going and jumping on the chest and pressing the chest. The patient, the person may not have had a good breakfast. Because of low sugar, he may have fallen down. So many times it has happened. No, it used to happen in my school. Somehow the other person in the assembly used to follow. We never press the chest. This is the sequence which you should follow. First and most important, you should call out the person's name if you know. Or if you do not know the name, say something, sir, madam. If there is a response, no CPR. If there is no response, go to step 2. Shake the patient, give physical stimulus, try to wake up. Still no, if there is any response there, no CPR. Then step 3, you are calling the name, no response, you are shaking, no response. Then go to step 3, checking the pulse. See, there are pulse can be palpated in the different portions of the body. You know that if you touch your wrist, there is a pulse. If you touch here, in the side of your neck, below, beside the airway, there is pulse. We usually advise to go for the central pulse here. Because when the person has fallen down, the BP may be very low. Heart is pumping all fine, but the BP is low. You will not be able to palpate the pulse here. So central pulse, directly the jugular. We say, in fact it's the carotid. You just put a finger here and palpate. If there is pulse, no CPR. If there is no pulse, then next step is CPR. So all of this thing, calling out the name, giving a physical stimulation, and checking the pulse should finish between 15 to 20 seconds. And I will demonstrate here now. Yeah. So no, I'm doing that. We'll do that. These are the first 3 steps to be done. Then, once these 3 steps are there, the result is negative, there is no response, there is no pulse, we go to the CPR. There are 3 components of CPR. Very simple, CAB, CAP. All of you book Ola Uber, right? That is CAP. Same CAP. C is chest compression, A is airway protection and airway opening, and B is breathing. D comes defibrillation, which I will deal later. That cannot be done by you. CAB is the sequence. Chest compression. So why do we give chest compression?
To stimulate the heart.
2 things. 1, sometimes the heart will be fibrillating. The heart rate will be very high. The muscles will be contracting abnormally and not pumping blood. This chest compression gives the stimulus to the heart and it comes back to its normal rhythm. Point 1. Point 2. Even if it doesn't come back to its normal rhythm, at least the blood supply to the brain is maintained. You keep on pressing the chest, the heart, because of the mechanical action, will keep pumping because you are pressing it. And the blood supply to the brain goes. Many times it happens that the patient is revived after 20 minutes, heart comes back but brain never comes back, brain dead. So it is important to maintain the end organ perfusion. This compression pump the blood out of the heart to the brain because that's the shortest distance from the heart. All the other organ doesn't matter. Kidney can tolerate, liver can tolerate for 2-3 hours without blood. Brain 5 to 7 minutes. So it is important to keep the chest pumping. So how to press and where to press? I will be telling the theoretical part first, then we will go for a practical demonstration, then we will be calling you people here for a revision. So yeah, so it is chest compression. How to do? In the center of the chest. make the patient lie down. I mean, already the patient has collapsed, if he is on the chair and all. Put him on the ground and usually come on the right side of the patient. It actually doesn't matter right or left, but right is more comfortable. And then start the chest compression like he will show now, like lay down. Lay down. So this is how the hands have to be held. Interlock your palms like this. Your dominant hand should be lower. If you are a lefty, left hand lower. If you are a righty, right hand lower. And press at the center of the chest. Your elbows and your shoulders should be in straight line. Don't bend the elbows. So show them how usually people do with elbows bent.
See, this is how you're not supposed to do, because if you bend your elbows, the energy will be lost, right? There is a movement, system movement, you will lose the energy. So all you have to do is keep your shoulder, elbow and arms straight.
And the fulcrum should be your waist. The pressing should happen from here with the full body weight. Which you are doing with your arm, you will get fatigued because it's only the arm strength. But when you are using your upper body strength fully to go down, the CPR quality will be better this way. How much deep you should be pressing? Theoretically, it is 5 centimeters or 2.5 inch. No one keeps a scale there. No, how is it going 2.5? Not possible. Press as deep as possible and as fast as possible. You should be doing this 100 times a minute minimum. Okay, 100 times a minute. That should be the speed of the compression. As far as depth is concerned, as deep as possible.
There will not be any damage for
I was expecting this question. I'm the CPR man. I keep doing this weekly once, and this is the first question everyone asks. What about the rib fracture of rib injury or injuring the rib? Correct. I'll address this. If you are fracturing the rib, you are doing a proper CPR. If you are not fracturing the rib, you are doing a cosmetic CPR for the name's sake. If the rib breaks, that means your CPR is good. You are actually helping the heart pump, and the rib fracture auto heals on itself without any surgeries. Nothing is required to be done. In 4 weeks, the rib cage heals on itself. There will be some fracture pain. We cover it with medication. I hope that answers that. You should be fracturing the bone. Yeah, so this is how it is done. And after 30 compressions, you need to give 2 rescue breaths. And another thing what you need to do, this was the compression, minimum 100 times a minute, press as hard and as fast as possible in the center of the chest. This is called as the breastbone. You feel your chest, there is a bone here. In the center of that thing, you need to keep pressing.
Should you have to look for an young person at that time to press? Yes.
Yeah?
You have to look for an young person.
Yes, you start doing, call the young person. He will take over.
Both are age. No. Both are age.
Ideally, younger the better. If young people are available, they should be doing it.
Stronger the better.
Stronger the better. Okay, and the second thing is maintenance of airway. One thing is you are pumping the blood. Okay, you are helping artificially pump the blood out of the heart. But is the blood pure? Because the breathing has stopped. The impure blood you are pumping. So how to make sure at least little bit of oxygenation is there? For that, airway is important.
By mouth.
Yeah, mouth to mouth breathing. And the mouth, before we go to the mouth to mouth breathing, the proper positioning of the head is important. You cannot just go and do it the way you walk. This is the point to airway. This is called as the chin lift and head tilt technique. Brother will show that.
Tilt your head.
Not your patients.
Yeah. Tilt the patient's head like this, and then hold his chin up. Okay. Tilt, hold the chin up, close the nose, and then give 2 breaths.
Yeah, what this does is it makes the airway in straight line. Giving the breaths and the delivery of your breath going to the lungs is simpler. This is step 2. Airway maintenance, head tilt, chin lift. Basically, put the head back like this and keep 2 or 3 fingers here and pull the lower jaw down like this. And then with one hand, pinch and close the nose. Step 3 is breathing. And after you have done that, you need to give rescue breaths. Fill your lungs with air, and with mouth to mouth locking, you need to give breath. So the frequency is 30 chest compressions, 2 breaths. 30 chest compressions, 2 breaths. If there is someone else beside you, change over every 2 to 3 minutes so that one person will not be able to do this till a help arrives. I think we will revise from first to last now. Brother will lying down uncomfortable.
First, scene is safe. Second is checking for consciousness. How do we check for consciousness? Physical. We call him, tap shoulders, touch him, and then ask him for his response. No response means he's unconscious. Now we call for help. How do we call for help? We usually yell at people, sir, please help me out, because there's a person who has fallen down. We don't have consciousness. Then let's say this gentleman comes, asks us what happens. We ask him, sir, please call an ambulance, because I have to do further diagnosis, right? We have to have someone who is there, who will help us, who will call the ambulance. Now he calls ambulance, he will stay there, because nobody moves out of the situation where there is help is needed. So he will call an ambulance, he is there. Now then we check for pulse, right? We check for pulse, we check for breathing. How do we check for pulse? We use carotid veins, right? Or jugular veins. So there is a hump here, we all have the throat hump, either left or either right. This is where we feel our pump.
Press deep and hard, you will feel your pulse. The people who have a fat neck will not feel with just the soft touch.
Yeah.
Deep and hard and tough, you will feel the pulse.
Please try once. There is a hump here.
It is easy for weak people, but those with fat neck may have some difficulties. Press deeper.
So press deep, check for pulse. At least 10 seconds we check. Within that 10 seconds you will feel the pulse. If there is no pulse, if there is no breathing, if the person is not breathing, that's when we do CPR. CPR is 30 compressions. 30 compressions and 2 breaths. So 30